Hello, everyone, and welcome to another informative episode on Soulmate Sessions, where we delve into a variety of topics concerning relationships, dating, intimacy, and overall well-being. Today, we're addressing a topic that many people are curious about, but seldom discuss in depth. What happens to a woman's body when she stops having sex for an extended period of time? Before we get started, I want to extend a warm welcome to all our new viewers. If you haven't already, please consider subscribing to the Soulmate Sessions channel, where we share in-depth videos about love, relationships, and intimacy. Don't forget to hit the like button so that more people can discover this video, and feel free to share it with friends and family who might find it enlightening. Also, stay tuned for our next video, where we'll discuss what happens to men when they stop having sex for a long time. Lastly, please note that the information shared in this video is for educational and informational purposes only. It should not replace personalized medical advice from a healthcare professional. Each individual is unique, and various factors such as age, health status, hormonal balance, and personal lifestyle can influence how one experiences a period of sexual inactivity. With that out of the way, let's jump right in. I would break this down into 9 subtopics. 1. What does long periods without sex often means? The phrase long periods without sex can mean different things to different people. For some, going without sex for a couple of months might feel significant, whereas others may consider a year or more to be a long time. In general, when discussing physiological or psychological changes, medical professionals often look at an extended period, such as 6 months, a year, or even multiple years, of complete sexual inactivity. This does not necessarily include abstaining from all forms of sexual expression, such as masturbation. Rather, it specifically refers to the lack of partnered sexual intercourse. It's also important to note that each person's baseline is different. Some women might be accustomed to having sex multiple times a week, while others may only have sex sporadically. A shift from a high frequency of sexual activity to none at all might feel more dramatic than a shift from a moderate or low frequency. This difference can influence how a woman perceives and experiences the changes associated with sexual inactivity. Number 2. Societal and personal factors regarding women having sex. Many women choose to abstain from sex for various reasons. It could be due to focusing on career goals, going through emotional healing after a breakup, practicing celibacy for personal or spiritual reasons, or simply not having a partner. Some women may also be going through life transitions, such as relocating to a new city or dealing with personal issues that temporarily sideline romantic or sexual pursuits. Regardless of the reason, it's worth acknowledging that society often places an emphasis on regular sexual activity as part of a healthy lifestyle. As a result, women who go without sex for extended periods might feel pressure or concern about potential negative outcomes. This is precisely why it's so important to separate myth from reality and to understand the genuine physiological and psychological effects of abstaining from sex. 3. Does long-term abstinence from sex affect fertility? One of the most common questions is whether refraining from sex for an extended period of time affects a woman's ability to conceive in the future. The short answer is no. Your fertility remains largely unaffected by the mere absence of sexual activity. Ovulation and the menstrual cycle continue as normal, assuming there are no underlying health conditions. When you decide to resume sexual activity, your reproductive system generally picks up where it left off. However, it's crucial to note that age is a significant factor in fertility. As women get older, their fertility naturally declines due to changes in egg quality and hormonal fluctuations. If a woman abstains from sex during a period in which her fertility would naturally begin to decline, say, in her mid to late 30s, she might interpret any difficulty conceiving later on as a result of sexual inactivity. In reality, the decline is more likely due to age-related factors rather than abstinence. 4. What is the impact on ovaries and the uterus for a woman not to have sex for a long time? Many women worry that stopping sexual activity might cause changes in the uterus or ovaries, potentially leading to conditions like ovarian cysts or uterine abnormalities. There is no scientific evidence suggesting that sexual inactivity directly causes any such changes. The uterus and ovaries continue to function as usual, regulated by hormones that are influenced more by the endocrine system than by sexual intercourse. It's worth noting that regular sexual activity can indirectly influence hormonal balance by reducing stress, improving mood, and sometimes even regulating menstrual cycles in certain individuals. Nonetheless, these are indirect effects, and a lack of sexual intercourse in and of itself does not damage the uterus or the ovaries. 5. If a woman stops having sex, will it affect her menstrual cycle and hormonal balance? Many women wonder if their menstrual cycle will be disrupted by not having sex for an extended period. Generally, the menstrual cycle is governed by hormonal changes involving estrogen, progesterone, and other hormones regulated by the pituitary gland. Sexual activity can influence mood and stress levels, which in turn can have minor effects on hormonal balance. But these effects are usually subtle. In most cases, a woman's cycle continues as normal even if she hasn't engaged in intercourse for a long time. In rare instances, stress or psychological factors associated with abstinence might lead to hormonal imbalances that can slightly alter the cycle. However, such cases are relatively uncommon, and the majority of women do not notice significant menstrual irregularities simply because they aren't having sex. 6. What would happen to a woman's vaginal health and elasticity if she stops having sex? Will it decrease elasticity, myth, or reality? A recurring concern is whether the vagina loses elasticity or becomes tighter when a woman stops having sex for a prolonged period. To understand this better, it's essential to grasp how the vagina works. The vagina is a muscular canal lined with mucous membranes that can expand and contract. During sexual arousal, blood flow to the area increases, and the vaginal tissues become engorged, making penetration more comfortable. When sexual activity ceases for a significant period, say several months to a year or more, the vaginal tissues might not experience regular stretching and engorgement. As a result, some women may notice that their vagina feels a bit tighter or less accommodating upon resuming intercourse. This phenomenon can lead to discomfort or mild pain during the first few sexual encounters after a hiatus. However, it's important to differentiate between natural tightness due to a lack of recent stretching and any pathological condition. If pain persists over multiple sexual experiences or becomes severe, it's advisable to consult a healthcare professional. In many cases, gradual and gentle sexual activity, coupled with adequate lubrication, helps the vagina regain its usual elasticity. 7. Will the vagina enter the phase of secondary virginity if she stops having sex? There's a popular myth that if a woman refrains from sex for a long period, she somehow regains her virginity, sometimes referred to as secondary virginity. This myth often arises from the idea that the hymen, a thin membrane partially covering the vaginal opening, can grow back. Medically, this is not the case. Once the hymen is stretched or torn, often during first-time intercourse or through other activities, it does not regenerate. The confusion arises because some women notice increased tightness or mild discomfort upon returning to sexual activity after a long break, leading them to believe that something akin to virginity has returned. In reality, what's happening is a loss of elasticity due to a lack of regular stretching, not the reformation of the hymen. This tightening is typically temporary and can be resolved through gradual, patient reintroduction to sexual activity, using sufficient lubrication and possibly doing pelvic floor exercises. 8. What would happen to a woman's libido and psychological factors if she stops having sex for a long time? One of the more debated topics is whether a woman's libido, sexual desire, increases or decreases when she stops having sex. Research on this matter is mixed, as libido is influenced by numerous variables, including hormones, mental health, stress, and relationship dynamics. Decreased libido. Some studies suggest that when women go without sex for extended periods, they may experience a dip in sexual desire. This can be attributed to a lack of regular sexual stimulation, which can lower the frequency of sexual thoughts and fantasies. Additionally, if a woman is abstaining from sex due to stress or emotional reasons, these underlying factors can further suppress libido. Increased libido. Conversely, some women report experiencing heightened sexual desire precisely because they aren't having sex. The mind may yearn for what it's missing, leading to more frequent fantasies and daydreams about intimacy. This response can be particularly pronounced in individuals who are used to a certain level of sexual activity and suddenly find themselves without it. Number 8. What is the arousal difficulties after prolonged abstinence from sex in women? When a woman has not engaged in sexual activity for a long time, she may find it more challenging to become aroused quickly once she resumes intimacy. Arousal is a process that involves both psychological and physiological components. The mind must be receptive, and the body must respond by increasing blood flow to the genitals. After a long break, the psychological aspect of arousal might require more effort. For instance, a woman might need more extensive foreplay or mental stimulation, such as erotic literature, romantic scenarios, or even counseling, to get into the right headspace for sex. The body, too, might need more time to reach the level of lubrication and blood flow necessary for comfortable intercourse. However, these changes are generally temporary, with consistent and considerate reintroduction to sexual activity, emphasizing extended foreplay, effective communication, and the use of lubricants if needed. Most women find that their bodies and minds adapt relatively quickly, returning to a state where arousal occurs more naturally. 9. Do women experience sexual frustration and psychological stress if they don't have sex for a long period of time? It's worth mentioning that some women experience sexual frustration or tension when they abstain from sex for a long time. This frustration can manifest in various ways, such as feeling more irritable, having intrusive sexual thoughts, or noticing a heaviness or ache in the pelvic region. These sensations are often the body's way of signaling a desire for release, and they can be addressed through masturbation or other forms of self-care if a woman chooses not to engage in partnered sex. In certain cases, prolonged abstinence can also lead to anxiety about returning to sexual activity. Thoughts like, "What if I've forgotten how to be intimate?" or "What if my partner finds me uninteresting?" may arise. Such anxieties are normal, but can be mitigated by open communication with a partner, gradual reintroduction to intimacy, and, if necessary, seeking guidance from a therapist or counselor who specializes in sexual health. In our next video, we'll shift the focus to men, exploring what happens to men when they stop having sex for extended periods. The male experience, while sharing some parallels, also has unique aspects related to hormones, erectile function, and psychological well-being. If you're curious about that or know someone who might benefit from this information, stay tuned to Soulmate Sessions for more updates. Ultimately, the decision to abstain from sex, whether for a short while or an extended period, is deeply personal and influenced by a variety of factors. While societal norms often imply that regular sexual activity is inherently beneficial, the reality is far more nuanced. Some women find liberation and clarity in abstinence, using the time to focus on personal growth or other life goals. Others may experience frustration, tension, or concerns about returning to sexual activity. Thank you for joining us in today's extensive discussion on Soulmate Sessions. If you found this video informative, please remember to subscribe to our channel to stay updated on future content covering all facets of love, intimacy, and relationship. Don't forget to hit the like button, which helps more people discover these insights, and feel free to share this video with anyone you believe would benefit from it. Once again, thank you for watching, and be sure to tune in next time when we explore the male perspective on abstinence and what happens to men's bodies when they, too, step away from sexual activity for extended periods. See you in the next video, and until then, stay informed, stay empowered, and take care of your well-being.